Oral diseases are among the most common and communicable diseases worldwide, affecting an estimated 3.5 billion people. Oral diseases and conditions cause physical symptoms, functional limitations, and a detrimental impact on emotional, mental, and social well-being.
All right, let's talk about oral hygiene and why that is important. And of course, we'll also look at the link between good oral hygiene and our mental health. And to help us with that conversation, we have Dr. Elvis Mutai, who's a dentist. He's don't worry about the titles. So he's a dentist right here at Smile Studio Dental Clinic in Nairobi. So good to see you, Doc. How are you doing?
Very well, thank you.
You see, there's so many titles that if I start going through all of them, surgeon, what else do you do?
Braces, orthodontist, then a bit of surgery, like you said, but mostly those two. But I lean more towards general practice.
General practice.
Yeah, because the patient needs all that.
I see that.
More.
I see that. Yeah. Okay, and again, we're focusing on good oral hygiene based on the day that is World Oral Hygiene Day, which was on the 20th.
Yeah.
And of course, the theme, I really like the theme. The theme was a happy mouth is a happy mind.
Yes.
But when we say good oral hygiene, what exactly does that mean?
Good oral hygiene will have to start right from, the fact that you have a mouth, it has other functions, speech, eating, among others. Yes. Then you want to start the hygiene not when you pick up something to clean, but when you're having all those practices you're using the mouth for. So you can have hygiene with speech, whereby sip water on a regular basis as you're going about your day. You can have hygiene with diet, meaning avoid your sugars, avoid the high calorific diet that has refined things that might cause tooth decay. And, people also put into their mouth various drugs that can also cause mouth diseases that are going beyond the teeth. Because oral hygiene has for a long time been focused on brushing.
Yes.
You have to take care of your teeth.
At least
so you forget
twice a day.
Yeah.
For 2 minutes.
Correct. So that to me is a top up and an adjunct to these other practices that you're doing during the day, because you see, you have your gums, you have the cheek, you have the tongue, you have all the way back to the throat right there. So for example, the guys who are doing for a long time tobacco are putting it under the tongue. Then we find oral cancers are arising out of that. Local bruise that you're going in. So you see, hygiene has started there with your ingestion, whatever you're putting in the mouth. So you should also have diet that is tissue conscious. So you're not involving your oral tissues to adverse effects of particular things that are in your diet. High sugars, high acidic foods and drink. Right?
I like what you said, tissue conscious. Don't just focus on what you're ingesting, because you're focusing on other parts of your general well-being, but also tissue conscious. One of the day.
One of the day, exactly. So be tissue conscious. So I think that should encompass what we call oral hygiene as a package. So that now by the time you're picking up your toothbrush, you've made it easier. And now you see that is now going to be only now that hard tissue where you're focusing on partly gum health, that is soft tissue, but mostly also the cavities and whatnot, that you want to use your fluoridated toothpaste, you want to use the right toothbrush that is soft bristles, you have the right technique for that. And then you can, if you have disease like say gum disease, we can add mouthwashes in there, but it's normally heavily driven by the mechanical function. So mechanical function being your toothbrush, being your floss, or nowadays we're seeing what we call a water flosser that you use now to clean your teeth. So that should not be the isolation of oral hygiene. It's whole spectrum. Yeah.
Now, you see, when you talk about mouthwashes and floss, a lot of people would say, I think we were discussing this earlier. So someone says, don't use a mouthwash every day because it's more prescription. And then there's this other quarter that says use mouthwash every day. So what is it that we're doing right? What is it that we're doing wrong? And what is it that we need to start doing?
So what I see most people saying is that, but I just put mouthwash in and then that's it.
That's it.
Right?
No.
So we can use the analogy of a dirty room. If you go into a dirty room with soapy water and just pour and then say, oh, I've cleaned, the water will dry out and the dirt will still be there. So think about that with your mouth as well. So mouthwash is the equivalent of that soapy water that you're pouring into the mouth there. Then you say, oh, I've just done the rinse and that should be okay. So it will tell you that it will kill the plaque, it will reduce the bacterial load and all these things, which is true. But if the dirt stays on, then it's a matter of time before they colonize.
Yeah.
Now remember, inside the mouth we have good and bad bacteria, and there's a balance between the two.
Yes.
When that is broken, that's when disease process begins. When one is overwhelmed, say the good bacteria is overwhelmed, then that is when the disease process begins.
Okay.
So the mouthwash is to help cater to the bad bacteria, but you see, it's not selective.
Yes.
So it will kill bacteria,
Even the good ones.
even the good ones.
Okay.
So that's why we want to keep it as a prescription only. There's this over-the-counter ones that mostly focus not on medicinal value, but maybe the freshness of the breath and
Yes.
what some people just want to have as a psychological comfort. What you're talking about, mental health,
Yes.
isn't it? So
Yes.
even what we are doing to satisfy the patient is we want them to feel certain way.
Yes.
So you're going to feel clean.
Okay.
You feel that the process is complete
Yeah.
when you have a mouthwash involved. Then these over-the-counter mouthwashes that have been marketed are fair enough in terms of your day-to-day use. There's no
Okay.
issue there.
All right.
They do play a certain role in terms of slowing down the impact of bacteria, but remember, it's going across the board.
Yeah.
But I want guys to pick up their toothbrush. I want you to pick up your floss,
Okay.
and I want you to mechanically remove the dirt.
Okay.
And then after the mechanical action, then
Then-
the feeling can follow.
Okay.
Where
Yeah.
you can have,
Feeling.
yes, whatever else that constitutes your feeling
Yeah.
can follow. But we see that even guys who in the Muslim culture, for example, they use the mswaki. So before prayer, they just pick the mswaki and use, and it's a stick.
Yeah.
We find that the oral hygiene is actually elevated
Good.
compared
Yeah.
to
Yeah.
the common people who don't do it, and then they're not having the same impact because they're doing 5 times a day prayer, that 5 times a day of mswaki.
So you've mentioned a lot of things that most of them were taught. One,
Yeah.
brush your teeth. Okay.
Yes.
2, at least understand the type of brush that you're using. But for a lot of people, the harder,
The better. Yes.
the
harder.
better.
Yeah.
Yeah.
Not really, because
Yeah.
the technique also matters in this sense, right? So you remember, yes, you have the hardest tissue in the body, that being the enamel of your teeth.
Yes.
So people think, they want to really scrub this thing down, isn't it? But then you are using the right, you're using the wrong technique, and you're picking the hard toothbrush. Remember, there's also soft tissue, because toothbrushing will not only focus on teeth alone, but also has the gum. But my advice is stick to the soft.
Yes.
Right, because when you're doing the brushing, the gums also need cleaning. Hard bristles will abrade your gum.
Can you trust them the technique? And I know,
Yeah.
in school you were told, you know
This is
how
what
we
to
were.
do. Yeah.
Yes, this is what
So
to do.
so the
Yeah.
technique is pretty simple, whereby you need to slow down, right? So they're saying going slow is going fast.
Yes.
That's why they have this popular folktale of the tortoise and the rabbit, isn't it? And then
Yeah.
the rabbit was expected to win, but instead the tortoise is
actually won.
right. So you're winning here is because you're now removing the dirt properly, as opposed to someone who's going fast, who's leaving a lot of dirt behind, causing gum disease and even hard tissue cavities and all these things
Okay.
that are happening over time.
Yeah.
So what you want to do is, first of all, don't do long strokes. That is now the rabbit running fast, because you want to move along your
Very fast, yeah.
So then you're done. No, slow down. So if you look at the span of your toothbrush, which is where the bristles are, you want to apply that onto your teeth, and you point it towards the gum. So don't put it flat, you point it towards the gum. And that is where the hard bristles will abrade the gum if you do
Yes.
that kind of brushing with hard bristles. So if you point it towards the gum, then it will go even in between the teeth better, which is where most of the dirt will hide.
Yes.
Because you see, on the surfaces of the teeth, you have your cheek lying there and you have the tongue on the inner side.
Yes.
They will tend to almost self-cleanse the teeth as you speak and as you do other oral functions.
Yes.
But in between, where the tongue and the cheek will not reach, that is where you want your bristles to also
So
penetrate,
actually, yes,
and that is where a lot of the food will settle. Because the other side, the tongue will rub or the cheek will rub, and most of the food will kind of reduce in bulk. And we see even when we're doing the cleaning, that is where a lot of the food packing will happen to be. So if you point it now towards the gum, and then the span of your toothbrush is touching, in this case, how many teeth?
1, 2, 3.
3,
Yes.
right? So that is where you stick, and that is where your stroke should be consistent. So you focus there and you clean only those ones. So you do like 5 or so strokes,
Okay.
and then you swipe upwards. Then you move to the next, do the same thing upwards all around.
Yeah.
And the same applies to other surfaces of the teeth. You stick to where the span of the toothbrush is, there and there, all right? And then you go to the inner side, you do the same, always pointing towards the gum, because that is where, and then up. And then the front vertically. You almost go per tooth here, all right?
Yes.
Because the width of most brushes can only manage maybe 1.5 in this fashion. And then remember, the tongue also needs to be cleaned because it's rough. It's not a smooth surface like, say, the cheek. So here is going to hold on to food. So make sure to also brush your tongue, especially the top side.
Okay. Another people are like, so how far back can you go? When brushing your tongue?
I mean, guys will gag at various levels, right? The sensitivity of your gagging can happen, even some of them closer to the tip than the others who can go all the way to the back. So if you stick your tongue out further and you're able to do proper brushing, that helps. Guys can also employ the tongue scrapers, which will help. There's also water flossers, so it just shoots water, so it will help with that as well. And then the water flossers have a special tip that will allow you to guard so that you're not shooting water into your throat and then hurting yourself. So it is very directed towards the tongue. The tongue is meant to be about pink in color. Some guys, because of melanin, or you can have some spots of black as well, which is fine. If you can take it down to that color, not white, because you know white means that food has been left behind, and that is where you're getting the buildup, and that's where you have your bad breath coming from most of the time. So tongue will produce the bad breath element of the mouth, whereby the teeth will have cavities that will pack the food, and then they'll also have the bad breath. But most of the time, if there's no cavity here, in between the teeth, we'll pack food, bad breath. On the tongue, you'll pack food, bad breath. So the more you can clean it, the better. Because after every meal is good. Try and get it down after every meal, if you can. Most people are too busy. You're eating a meal in between. Like here, you're rushing to another shoot or something that you can't do.
Like whatever.
So if you take it down to a bare minimum, or at least twice a day, that's fine. You can do your thorough brushing. But the more you do it, the better for you. And also incorporating that, sipping of water, rinsing your mouth consistently. That's excellent.
Good. Okay, so we need to go on a break. But before that, can we also address sensitivity? Because there's a lot of myths and disinformation and misconceptions surrounding sensitivity. I don't know if you're able to do that in maybe like a minute or minute.
Yes, sensitivity will come about because you have gum that has pulled away because of gum disease, exposing the sensitive part of the tooth. So that's the root surface. So if the root surface is exposed, then you get the sensitivity. It can also come about because of that will cause generalized sensitivity or a regional sensitivity. Say, for example, someone say, my lower teeth are always sensitive, or my back teeth are always sensitive. But then if it is specific to a tooth, that's a cavity. So that one, please see your dentist for them to tell you why you're getting the sensitivity, the source of the sensitivity. Is it this or that? If it is regional, then there's all manner of things we can give you, like sensitive toothpaste. Toothpaste specific for sensitivity, to address the sensitivity. There are certain components that they can sort of desensitize the tooth. Some we need to do it here because we find the desensitizing toothpastes are not able to assist with that. And then if it's a cavity, we need to fill it, and you're done.
All right, cool. So how about we take a break, and then when we come back, we'll really focus on World Oral Health Day, and of course the theme for 2025, like we said, is a happy mouth. A happy mouth is a happy mind, right? So then we'll link the two, and also the whole aspect about mental health, which you touched on a little bit, and also what we need to do better moving forward. All right, so all that is coming up after the break. Do stay with us. The show is Health Diary.
You are watching Health Diary, brought to you by Sensodyne.
All right, welcome back. The show is Health Diary, and we're focusing on a very important conversation that each and every person should pay attention to. And this is as far as our oral hygiene or our oral health is concerned. And to help us with that conversation today, we have Dr. Elvis Mutai, who is a dentist right here at Smile Studio Dental Clinic in Nairobi, giving us all the tips and all the bad things that we've been doing. We've been doing wrong and how we can get it right. But now we want to focus on a theme for this year's World Oral Health Day, and that is on a happy mouth is a happy mind. So, Doc, so what is the link between the two? Because we were discussing this about this earlier. Said most of the time when you think about like oral health and our oral hygiene, we don't really think about the link between like mental health, and all those things. So, is there a link?
Big link, yes. There is a big link because you find that guys who have, say, for example, the common one. right? Where we start with when we, you have a child who's developing, they can walk around the room naked and they'll not even care. They'll run across the room without a pair of pants or something and they won't care. Then they get to a certain stage where they become self-conscious. Then now that's when the teenage or the puberty kicks in. And then suddenly they start worrying about a tooth that is out of line and all these things. So then they insist on the parent, and the parent is like, but you're fine the way you are. No, I don't like the way people are making fun of. And kids are known bullies in school, right? So you've had kids coming in with their parent because they're unhappy about their tooth. The parent thinks they're fine, but the kid is insistent. And maybe they might not cover the background of school bullying that happens. And nowadays, with all this, the Kenyan dream, which has been sold by various manifestos, I think various regimes that are coming in, they're saying, we will make affordable housing and all these things. So we have not matched the resources or that to support housing in this country. So you find boreholes are being dug a lot more. So before this whole affordable housing thing came into power or into effect, we had people or certain areas known to have brown teeth. But now it's more rampant because we're sinking a lot more boreholes because the city council or the people responsible to providing water are not doing it. So we've privatized water supply. And that means boreholes are being sunk, that is hard water. Then we get a lot more cases of fluorosis happening across regions, not limited to certain areas. Right? So, you brought up in Kilimani and you have brown teeth. How before we would see guys from Gong, Kikuyu and other surrounding areas having that issue. Because here it was controlled by city council. So those bullied children and the brown teeth causing the bullying now impact them, and then they started smiling without showing their teeth. And now that has to do with the color of teeth. Now they come in and we have to take care of that. Ignored, then that child advances and they start to struggle with that aspect of, now let me accept this is my fate, let me accept this is what I'm going to be bullied, and then they stop showing their teeth. So then we have, of course, a manifestation whereby now it's the inverse, where you have a mental issue and then your teeth manifest the mental issues that are existing. This is the negligent people. So you might have just nice teeth, but then, you're negligent.
Right.
So you have holes everywhere, teeth missing, decay happening, infections in the mouth, among other things. So the mind is not happy to begin with, then the teeth are manifesting the same. And then the others who are taking medications around mental health, and then the medication as a side effect gives us now issues in the mouth as well. So they're tied in very, very closely. So one of the aspects of treatment in terms of the mental health has to start there. And then, of course, now we have to address things that are not color, but either shape, either spacing, because that guy's missing teeth as well, right? Because, sometimes you're born without teeth that don't form. So it's not your fault to begin with. So that again might have someone not smiling as often. And you have people who have very wide gaps and they're not happy about it. And now we also need to address all those things. Now, unfortunately, in that incident where now we are more or less handling aesthetic than we are dealing with primary concern of pain or, sensitivity, then the price points tend to be higher. So now, again, we're causing you financial stress on top of on top of another issue that is supposed to be tied in with what we are considering self-esteem and in that sense. So we have all this manner of options and with various price point and affordability, but the quality end tends to be more pricey than this affordable end.
Interesting. So then how do we approach this and not just focus on good oral health, because we need fresh breath, we need clean teeth, we need to avoid fluorosis and all these other conditions that come about, but also focus on the mental aspect and even physical health, like you said, because health is health.
Mine is to say that first start with the bare minimum. Despite everything, appearance, number of teeth in the mouth or not, start with the bare minimum of, first of all, give us a good foundation to work with. Right? Because provided it's aesthetics, it means time can handle that. Finances are never the same. You can earn this much today, but tomorrow it will be better, or you can put in a small down payment as you go up until you clear. But then if you're coming to us with a poorly done or taken care of foundation, then you're just taking up your cost.
I see. And even when we think about approaching it in a more holistic way, like you said, affordability sometimes is a problem. Is a problem for so many people. So the question would be, so how then do we make it better even for them? And I'm asking this for, say, policymakers and even our healthcare system in terms of making sure that, yes, in as much as we're saying primary healthcare, but also we're considering people who can't afford.
I think they just need to stop associating dentistry and aesthetics, because, I mean, say for example, what disease can you say that this is a broken bone? It's never going to be aesthetic. That's considered an emergency, right? But you can put a broken bone not in a very aligned way. So it's not broken, but it's not aligned properly, right? So then people call that a malunion, and then that's what they'll go and treat, and that there's a code acceptable for that. So people need to stop thinking, policymakers or whoever it is, insurances and all these guys, need to stop thinking about dentistry as aesthetic. If we put for you a crown, it's not for aesthetic purposes all the time. It's also a structural impact on the tooth. We need to maintain that, and the crown is assisting that from happening. Now, that way, we will see a lot of, and anything government involves itself in tends to be subsidized. So because they're putting in the resources to cater to that.
Oh, I see. I see. Interesting about the pregnancy and okay. My brain is like an overdrive. So then as we bring this to a close, and the theme that we set for this year's World Oral Health Day is on a happy mouth is a happy mind. So what would be your call to action to everybody, from the general population to the healthcare providers to government, in terms of the healthcare and all those things? What would be your call to action?
I think the call to action would be, I'll circle it back to the theme, whereby a happy mouth is a happy mind, right? So we are empowered with so many things as dentists and as oral health practitioners, and this is of various cadres. We're empowered with so many things that we cannot compact into one thing. So what we just need to isolate that we don't have aesthetic health, and then we have primary health, and then we have we have health. Right? And my call to action, everyone, is that give us the resources we need, and that includes you as a patient. You're our resource for us to manage the health. Give it to us. So come to us, and then we will do what is needed for you now to have that health.
All right, I see that. Thank you so much for your time.
Thank you for coming.
Time is very short, and yet there's so much that we can cover as far as good oral health is concerned. But thank you. We'll try as much as possible and bring this conversation to open, so that we empower as many people as possible. But thank you so much for your time, Doc.
Most welcome.
It's time now for you to take a look at this health tip.
For the health tip of the day, I want to mention about gum bleeding, which is common, especially in adults and sometimes even in children. When you see gum bleeding, it means your gums are inflamed. It doesn't mean you're hurting yourself when you're brushing. So that's a clear sign you need to visit the dentist. Another clear sign is, for example, when you have your teeth that are becoming brown with time. So you never had the brown teeth, but they're losing their shine. That's another sign you need to come to the dentist. So mechanical action will stop the bleeding. So you need to brush better to stop the bleeding, floss better to stop the bleeding, and you need to come see the dentist for your clean so that you can get the bleeding arrested to a certain degree. So please see your dentist for your regular oral hygiene, because again, as we're saying, a happy mouth is a happy mind, and that happy mouth will start with that. So you have bleeding happening because of inflammation, and if it is consistent, meaning it's over time, it turns to a chronic inflammation. So your body is constantly in a state of inflammation that doesn't give you fever, doesn't give you pain, doesn't give you dysfunction, but it is just a constant state of, it's not good for the body. So for a healthy, please come for your regular check and clean to the dentist as regular as your dentist will advise.
All right. Well, clearly, as you can see, there's so much to oral healthcare or oral hygiene than just the color of our teeth and how many times we need to brush our teeth. I hope that you've learned so much from today's conversation, and of course, on a special emphasis on the theme, and that is a happy mouth is a happy mind. And now I know you understand the link between good oral hygiene or good oral health and mind, all right, and our mental health as well. But if you have any other question, engage with us on our socials. That is at NTV Kenya, both on Facebook and on X. My name is Winnie Lubembe, and a special thanks to Smile Studio Dental Clinic right here in Nairobi for hosting us today. Until next time, adios. Diary. My name is Winnie Lubembe, and we're coming to you from Smile Studio Dental Clinic. Sorry, Louis.